All right, so today there's 240 active cases, people with COVID in the Greater Shepparton local government area, and in the last 24-hour reporting period there's been 12 new cases. 8 of those are linked and 4 are still under review. Of course, at the moment we're still seeing the main routes of transmission are caused by people going from household to household still. That trend hasn't contained. The other thing that we're noticing as well is that people are still leaving it a number of days, not only hours, but a number of days between when they develop symptoms to when they actually go and get tested. So clearly any delays that occur from when people develop symptoms to then going and getting tested and being diagnosed means that it places more people at risk in the community from contracting COVID, but not only that, their household members as well. So as soon as you get any symptoms of COVID-19, don't wait even a few hours or half a day, don't even wait 1 hour, go and get tested straight away, because it's the best way for us to get on top of what's happening. In regards to inpatients at GV Health, there's 7 patients currently admitted at GV Health. 2 of those are in intensive care and 1 is on a ventilator. The other thing that we're encouraging people to do, if they haven't already done so, of course, is get vaccinated. So the Get the Jab Done campaign is really going quite well now. So it was the 8th of October that we launched the target of 5,000 people that we were aiming to come forward for their first dose of a COVID vaccine in the Shepparton area that hadn't been vaccinated. So pleasingly, of that 5,000 people so far, 3,081 have come forward to be vaccinated since that time. So we're just a touch under 2,000 people now that have not had their first dose vaccination. So if you're among those 2,000 people, please, if you haven't already done so, book an appointment straight away to get vaccinated, because we know it's the best chance of protecting not only you, but your loved ones and the people that you care about the most and the broader community. So please book online at coronavirus.vic.gov.au or 1800 675 938. And of course you can also book a vaccination at a local GP clinic or at a community pharmacy as well. So we're almost close too in terms of the name for the second bus. So Jabba the Bus has now been operating for a number of weeks across the region and again proves to be really successful. So we're going to have the second bus on the road probably around the middle of the week, we think, and we've narrowed it down to those names in terms of the votes which have now closed. So it'll be one of these names, the Vaccine Queen, Jibba, Inspector Morse or Maxine Vaccine. So the votes have now closed, and in the next 1 or 2 days we'll be announcing the name of the second bus, and as I said before, we'll have the second bus up and out on the roads around the Goulburn Valley towards the middle of this week. Happy to take any questions from here.
We know that a number of schools now have been wrapped up as exposure sites. Is that of concern to you about where transmission is going at the moment?
It is, in the sense that the vaccination program, of course, has been based on a prioritised system of people working in frontline roles such as healthcare workers, people who are older members of the community that have chronic and complex disease, and progressively it's worked out to school-age children, whether that be primarily secondary school now, in terms of where people aged over 12 can be vaccinated. So it is a little bit of a concern in the sense that transmission is occurring amongst the schools. Pleasingly, the uptake of vaccination for people aged over 12 in the Shepparton area is pretty good, but we are encouraging again anyone who's eligible to be vaccinated. There will be a slightly different approach in terms of how the schools will be managed. So we know now that, as we've talked about before, Tier 2 sites and secondary close contacts will no longer be part of the response the contact tracing team is focused on. So what they're concentrating on now is working to understand who's been diagnosed within a classroom type setting, and then working through and bringing forward the primary close contacts, so other students in those classes to come forward and be tested. So it's going to be, I think, a more tailored approach in the coming weeks in relation to schools and more of a focus on classroom settings. I understand that some schools have chosen to close for a day or two while they assess and understand what the situation is, and our contact tracers and the Department of Health are working with those schools and the Department of Education. But more broadly, in answer to your question, it is a concern, but it's not something that we're, I guess, not unfamiliar with now, and we know how to manage it. And it's really about making sure us as a health service and other providers have the testing capacity there, which we do. So if you are a primary close contact, come and get tested, and most primary close contacts will now be required to isolate for that 14-day period. But the secondary close contact, so if it's a student of a classroom in that house, that person will be required to isolate for 14 days. But say the parent, guardian or siblings that would have previously been a secondary close contact will no longer need to isolate for that 14-day period.
Would you expect that we're going to see probably similar numbers in the next few days as these close contacts kind of come about?
In terms of positive cases?
cases?
Yeah, possibly, I think so. I guess, so it is possible and quite likely. It was interesting to see our numbers drop back to the mid-teens or less today compared to the 22 and 33 that we saw in the previous two 24-hour reporting periods. But it's, you know, in terms of, it is possible and likely we'll see, well, I know we'll definitely see new cases today, but in terms of how to reduce that, the best way that people can do that is to get vaccinated and also wear a mask. I mean, the masks are really important in terms of, as we know, that the way this virus is transmitted is aerosol based droplets, really small microparticles moving around in the air. So the best way to protect us from inhaling those particles is to keep a mask on, and that's a really important thing in a classroom environment, in any environment you might be where there's other people around, is to keep a mask on, keep sanitising your hands, and all of those little things that make the difference.
Do we expect to see schools closed sort of as we keep going down the line, when we get, you know, 'cause there will be kids that keep coming to school positive or are close contacts? Will we get to the stage where we don't shut the whole school down when there's a positive case?
Yeah, I think that's the direction where things are going to head, is that it'll be a much more tailored approach based on an assessment of the risk in terms of the person who's tested positive. So in this case, if it's a student in a classroom, and how widespread the risk might be to not only other students in that particular class, but more broadly across year levels. The policy though, however, I should say, is just being reviewed and refined by the Department of Health and the Department of Education, and that's really where it sits in terms of those policy settings at the moment. And I expect that we should be able to have some more information towards the end of the week in relation to that.
Yep, and there's been the announcement today or this morning about changing to isolation periods after being a close contact. Does that kick in for people that, say, have been exposed today and told to get a test? Do they have to isolate for the full 14 days? Or when it comes to Thursday, if that's their day 6 or whatever it is that then they can be released after that?
I haven't seen the detail on that policy announcement, but for the moment, the advice to people is if they are a primary close contact from a Tier 1 site, they will of course be required to get tested and to isolate for 14 days. But I think what is alluding to, there will be some form of transition period towards the end of the week, and we'll share that information once it becomes clearer.
From Friday, obviously the restrictions are going to change, and we're going to see a lot more movement around in the community, including people being in homes. I guess, is there work that you guys are doing to potentially plan for a rise in cases?
We've had plans in place from a contingency perspective if we did see cases increase in the community, but also in terms of people requiring admission and inpatient care, or first of all care in our emergency department, then admission to a ward or our intensive care unit. So we've had those plans in place since the COVID pandemic began. We're actually taking the opportunity to review them in light of the Burnett Institute modelling that was released back in September, and we're taking the opportunity to review them in terms of the revised Burnett modelling that came out yesterday as well. So at the moment, we know our staff have continued to work incredibly hard and put in extra hours and worked overtime and the like, just to keep not only our COVID services but all of our services open. But I'm confident with the plans that we have in place that we would be able to accommodate any surge in demand should that occur in relation to COVID.
How much do you expect cases to rise by, say, the middle of next week? Do you think we'll be bumped back up to 20 or 30 a day when restrictions loosen?
Yeah, it's a bit difficult to sort of. So our 7-day average it's probably better to look at it on a 7-day average. We can look at that and come back on Wednesday with some more information. It's so free, and the reason I say that is because on Friday it was 33, Saturday it was 22, and today, in terms of the last 24-hour reporting period, it was 12. So the numbers can jump around. So I think it's more important to perhaps look at the 7-day average to see what's happening.
But in terms of restrictions loosening as well, is that going to increase cases?
It's definitely projected to increase the cases, absolutely. The Burnett modelling is really clear on that. That when the 70% first dose was achieved, and then the 80% and the easing of restrictions does shows that there will be an increase in community cases, and also then a subsequent translation to ED attendances and inpatient care as well.
And then just finally, in terms of the people at GV Health, what are the vax status of them? Are all of them unvaccinated?
I don't have that information offhand, but I know in general across Victoria that at least in the early part of this month that over 81% of people that were admitted weren't vaccinated, that were admitted to a hospital weren't vaccinated, and over 90% that were admitted to an ICU weren't vaccinated. So in terms of our status, I just don't have that information to hand. Yeah.
Awesome. Thank you.
Thank you.
Thanks.